Moments That Matter is brought to you by Binkley Ross Family of Funeral Homes and First Southern Bank.
Welcome to Moments That Matter. I'm Melise Oakley with the Voyage Senior Living. Today we are back again with Rebecca Edmondson, founder of Priority Medical Group. Our subject is procedure called PRP, one I know all about. Rebecca, thank you for joining us today.
Thanks, Melise, for having me.
I like to talk about this because I've personally been on the side of what you've done with PRP, but let's just educate individuals. What is PRP?
PRP is a product of our own body. So it is a component of our blood. It's our platelet component of our blood. And so I like to tell my patients, if you cut your arm and you form a scab, it is platelets that are there to mediate the healing response. And so we take the blood from the body and we spin it down and we concentrate the platelets, and we can use this for so many different things.
What is your experience with the PRP? Like, how did you get into the PRP? Because there's a lot of people that don't know what that is.
Well, the funny part about that was I was working in orthopedics. And so when I first got out of school, I had, as a physician assistant, we inject a lot of joints. We inject it with steroids, so people know about that. We know about hyaluronic acid. We know about these different modalities that are supposed to help prolong surgery or prevent or delay having to have surgery. And so I am watching some sports on TV, and one of my sports people were out for PRP injections. And I was like, what the heck is a PRP injection? I should know if it's an injection, and that's what I do. And so as I did my research, I realized this is what rich people do. This is what people that are athletic do, that are getting paid the big bucks. They can't just go under the knife whenever they get hurt.
Right.
They will lose their contract. They'll be out lots of money. As I get to looking at that, I was like, wait, I would like to be treated like a multi-million-dollar player. So how would I get to do that? So as I researched about PRP, there was some training down in Tampa that I was able to go to and learn how to do PRP myself.
Like you said, there's professional athletes that have it. I have had the vampire facial. And what exactly is that?
If the platelets are present, what we are doing is we are placing a concentrated platelet in the area that we want you to signal for growth factors to come in and start to mediate healing in that area. So essentially, we are tricking the body into thinking it just got hurt. We all know if I just cut my arm and it's bleeding into that area, my wound is gaping open, and I can see there's no skin in between the gaping area. But in the presence of my scab, it scabs over. As long as I don't pick it, thank you, Mom, then I won't scar as bad, because in the presence of platelets, it will mediate healing, right? Using that piece of how our body heals, we can manipulate this by drawing blood from your arm, spinning it down, and we're going to cause micro trauma to the face, which will help heal or help, I guess, really what it's going to do is help encourage blood flow to that area, which blood flow is going to bring in the healing properties we need to start to remodel.
And it helps with age spots.
Yes.
It helps with, I know that I had
melasma.
Right. And then I also had a mole that was taken off. And we put PRP on that, and it healed
with the
so
scar.
quick, and the scarring and so forth.
Well, I got into it because I was suffering from lupus and rheumatoid arthritis, and my joints were miserable. I really didn't learn about PRP to help my patients. It wasn't on my radar at that point in time. I was struggling to even wear shoes. I probably had 1,000 pairs where I would go and try them on at the store. And then when I get them home, I'd just not be able to wear them very long because my feet were so damaged with arthritis. And so I was feeling very desperate. And so I actually learned how to do PRP to inject myself. And so that was my first experience. So here I am at my job doing this for myself. And I just started getting such great results from these treatments. And I had almost convinced myself that it was I was in remission, but then I had the opportunity to start working at a place that I could offer PRP injections with certification. And so I remember the first time that I actually did PRP with a patient and how ecstatic they were about the fact that they were like, I thought my life was over. It wasn't going to get any better. He was very emotional, and he said his family was in the lobby and he wanted them to come and talk to me because when I first saw him, he was so uncomfortable. He was just moving in his chair and he just seemed like he couldn't even concentrate. He was hurting so bad. And so my very first patient, I was able to use the PRP injections with him into the area that he was hurting at. And each time that I did it, I noticed his mood was improving.
Yeah.
And then when he came in, he was like, oh my goodness, this is just
my life.
And I remember feeling that joy of like, dang, it wasn't just me. It's amazing that it works. So it put it on the radar for me, and it made me offer it up to more and more. The more I did research on it, it wasn't just about orthopedic procedures. Mm-hmm. It went from doing joint injections to, yep. And I had patients that didn't want to have or where surgery was contraindicated in that we were able to use PRP to help them get better or help with their mobility and their pain. And then it went from the aesthetics because I found out that you could do that, and I like to do things that are fun like that.
Better.
Yeah, exactly.
But results may vary.
Of course, yes. So I found in the 6 years that I have been doing PRP, I've always been that clinician that I don't like to fail. And so when I have a group that didn't get as much as I did or that first guy out of it, then I'm always reevaluating like what was different. There are certain conditions where you may have low platelet count where no matter how much I try to concentrate it, I can't get it to. And then really I'm not healing with the injection. I'm promoting your body to heal itself. And so if you're not healthy enough, malnourished, or have a disease condition that's going on, this is where you see that variability of whether it works for some or doesn't. However, I do feel like if you start working with the patient to help improve their nutrition and help looking for those treatments of the underlying cause, that it does improve the outcome, even in patients that may be a little difficult to treat. But we've had pretty good success.
I can tell from firsthand that I had, I've had several surgeons say that they needed to do some surgery on my feet, and we have done several different treatments, and it's unbelievable, and it's life-changing what you have done for me. And that's why I want to educate people, because I think it's very important that there are things that you can do, and I love the fact that you're always trying to find that. Now, where could they find this PRP?
So we do offer it at our Marion location next to Kroger's. We have 2 medical providers that offer PRP injections. We also have physical therapists and chiropractic care. It is a process.
And it's a whole body.
Yeah, absolutely. So you come in and you get screened, and we look at the condition, whether it be skin or hair loss or joint pain or scar removal or scar improvement, I should say.
Well, and you treated a dear friend of mine that had cancer, and you treated her scalp. She had chemo, lost her hair, and now she's got beautiful hair. I'm like, it has come back like lush. It's so crazy.
It is fantastic. That's one of those where it takes a clinician to evaluate and understand the level of scarring, or if it's scarring. If it's scarring, you have a much better improved outcome. But they would come in and be evaluated by the provider, and then they would talk through the treatment plan. But most of the time it's simple. You can continue your normal activities. We just ask you don't take certain steroidal
Right.
anti-inflammatories and no steroids and that sort of thing. Just little simple things that you can do. We may tweak your diet and you may lose a few pounds while you're doing it. And then I think the best part about it is that it just feels like you're healing and
it's with your own body.
Oh, yeah.
Like that's what I had a lot of people say, oh my gosh, this is so crazy. But I'm like, it's not, it's your own body promoting healthy cells, so forth.
Absolutely.
So that's what's so cool about it. Also, insurance.
They'll say things like, it doesn't work for everybody, but neither does Prozac, but they'll pay for that,
Right.
I think what you have to do is realize this is investment in your body.
Right.
I don't think it's a huge investment to ask not to be miserable. If you ask that man that I helped and his family, the quality of life, he said he didn't know how often he said he couldn't do something because of pain until he was out of pain. And it brought him to tears because he could have quality of life. And so we keep shoving money into the bank, waiting for a rainy day. But I mean, you're miserable. You need to invest in your body, your vehicle, instead of buying these expensive cars and Netflix and junk food. If you look at
coffees,
and let's be honest, what's your copay and deductible for your surgery that you're going to end up having? They don't pay for that, And so when you look at the cost of PRP, it is an investment. And
for your quality of life.
Yes. And patients often ask me, how long does it last? And I do like to use my own example. I have a scar on my arm. I have injected the scar. It's dissolved out the scar tissue. It gives a visual aid of how long does it last? Well, I would have to be cut again for that scar tissue to come back. So there's a good example of this is promoting healing in your body. And most patients that are repeat customers are patients that have benefited in their right knee and now they want their left knee done. It's not a matter of everyone can find the money to take care of themselves. We just invest it in the wrong direction, but it's very reasonable.
And you also have specials a lot of times.
Oh, yeah.
You run specials all the time and it's very affordable.
Yes. Typically we'll do 2 areas. You pay for the first area. I'll do the second area for the half price. And so we do things like that. We try to keep the cost low. At our clinic, we probably charge a third of what you would get in a big city. Yeah.
Right.
Because I want you guys to know. I want you guys to feel the difference. I want you to be able to experience I'm not hiding a secret weapon in my back pocket. I want to be able to offer it. It does no good for me to go through all this training and not be able to offer it to our community and make it affordable for people that are, average Joes.
Well, that's the thing, like with your clinic, it has changed my life. And so I want to spread the information because there is a lot of stuff that's coming out of your clinic and your providers that is there. You've surrounded yourself with amazing people. And so thank you for doing that. Thanks for coming on the show.
Thank you, Melise.
If you enjoyed today's conversation, please subscribe, leave a review, and share this episode with someone who may benefit from learning more about the healthcare resources available in our community. Until next time, remember that every moment matters.
Moments That Matter is brought to you by Binkley Ross Family of Funeral Homes. Locally owned and operated. Binkley Ross Funeral Home, Blue Funeral Home, Mitchell Hughes Funeral Home. Call 618-997-7771 or go to binkleyross.com. And First Southern Bank. Bank with people you know, who know and love Southern Illinois. Community banking at its best. Find us at firstsouthernbank.net.